Let's talk about potassium, the heart rhythm hero. We've discussed sodium in another video. Now let's talk about one of the other major electrolytes that we see within the human body. All right, so let's see what potassium, why it's so important, and some basic information about it. Potassium is one of the most important electrolytes in the body, right there up with sodium. It's one of the bigger ones. So it's important that we understand where it's located, how it moves, and what it means for the body. Potassium is located inside of the cell, in the intracellular space. That's where its home is. However, it can move in and out of the cell depending on what the body needs. Its normal value is 3.5 to 5. And its main job is to help with muscle contraction and controlling the muscles as well as the heart rhythm. Remember, the heart is a really large muscle, so when we talk about muscle contraction, that's always going to include the heart. In fact, the heart is so important with potassium that we always want to associate potassium to the heart directly. If we see anything related to a potassium problem, I always want to think heart first. What's the heart doing? Check the heart. How does potassium move? If its home is inside of the cell, how does it get outside of the cell to help the body out? Well, there's two different ways. One, it will use the sodium-potassium pump, that active form of transport that we used with sodium in the other video. That's going to help it move inside and outside. But remember, it needs insulin to help be that gatekeeper of the sodium-potassium pump. The other way is going to be that the kidneys will help regulate potassium. This is incredibly important to know because if the patient's kidneys are not healthy or they're just having a problem with them, those kidneys might not be able to move potassium appropriately. So make sure we're keeping an eye on those kidneys as well. All right, so what can actually mess up potassium? What can make it go too low or go too high? Well, low potassium is where there's just simply a loss of potassium from the body. This value will be anything less than 3.5. This could be caused by the use of diuretics, which you'll see a lot on NCLEX. It could be from gastrointestinal losses, such as vomiting, or even using nasogastric suction continuously or at a much too higher rate for what the patient needs. With diuretics, we want to make sure that we remember that there's different types of diuretics, and different types of diuretics do different things to the electrolytes, like potassium here. For example, loop diuretics and thiazide diuretics will cause potassium to leave the body, creating a loss. So if the patient is incorrectly using these types of diuretics or the prescribed order is too much and the patient starts to lose too much potassium, it could cause hypokalemia or low potassium in the patient. Now with high potassium, these are going to be lab values that are greater than 5.0. This means that the body is retaining or holding on to potassium. This can be caused because the patient's kidneys are starting to fail, so we'll refer to this as renal failure. If the kidneys are unable to regulate what potassium is doing because they're sick on their own, then the potassium will start to retain in the patient's body and not be excreted out through the urine. ACE inhibitors also can cause high potassium levels in the patient's body, as well as if the patient is simply taking potassium supplements, and those might be causing the potassium levels to rise. Remember that if the kidneys are failing, potassium will probably go up, so keep an eye on that. What the patient looks like when they have a potassium imbalance. So first off, with low potassium, symptoms will make the patient appear weak and slow. For example, their muscles won't contract well, so they'll become weakened. They might have some constipation because the GI system is starting to slow down. Their reflexes will be decreased, so they'll be weakened or slow. And then we want to pay close attention to the ECG or the heart rhythm. In low potassium, the patient's heart rhythm will show a flat T wave. That flat T wave will be one of the biggest indicators that the patient is experiencing low potassium. For high potassium, the heart becomes very unstable, so we'll consider this dangerous for the heart. Symptoms that we'll see here are, again, muscle weakness, but now we're going to see irregular heart rhythms or irregular pulses. And in this case, with high potassium, we're going to see a tall T wave. So the higher potassium, that tall T wave starts to occur. High potassium is extremely lethal and life-threatening and can cause cardiac arrest. If you happen to see an irregular pulse or assess an irregular pulse on your patient, or it's mentioned on an NCLEX question, potassium imbalances such as high potassium or hyperkalemia should be one of your first thoughts in trying to keep the patient safe. Potassium questions are usually asking you, well, what do you do about something? Not only what would you assess, but what would you do? Your biggest priority assessment for any sort of potassium imbalance is going to be making sure that you monitor the patient's heart through some sort of cardiac monitoring. Next, you're then going to check the patient's lab values and determine if their potassium levels are low or high. This will differentiate what sort of treatment you need to give. For low potassium, we simply want to try to replace the potassium that's lost from the patient's body. We can give potassium either oral or intravenous or IV routes. The thing to keep in mind with low potassium treatment is if you do want to give IV potassium, IV, you should never IV push that medication. It is extremely dangerous and can actually stop the heart. For high potassium, we want to try to decrease or lower that potassium, of course, as safely as possible. One of the first drugs you might see ordered would be something called calcium gluconate. This will be ordered to protect the heart. The providers want to stabilize the heart before we start to shift any electrolytes around like potassium that could change the heart rhythm. Next, in order to help shift the potassium from the area where it really shouldn't be, which is outside of the cell, we're actually going to have to use insulin and glucose. Now you might ask yourself, insulin and glucose, is this patient diabetic? But remember, one of the ways that we transport potassium in and out of the cell is by the sodium-potassium pump. This pump can only work if it has insulin to help control what I like to call kind of like the gatekeeper of that sodium-potassium pump. So we need to give insulin so that that pump can work appropriately, and potassium can go from the outside of the cell and go back to its home on the inside of the cell. We'll also include glucose with this because we want to be super careful when we're giving insulin that we don't lower the blood sugar too fast in our patients. So we'll give some glucose with this just to kind of maintain their blood sugar levels at the same time. An additional way to lower potassium would be to use an enema medication called sodium polystyrene sulfonate. In other words, the brand name is called K-Axalate, or I'll tell my patients it's called the Big K. Now, this is an enema that will be given through the rectum so that the patient actually produces a bowel movement. Of course, we know that they're going to have a bowel movement, but the end goal of this use of the medication isn't just to have the bowel movement, but it's actually to lower the potassium. So after giving this enema, we'll want to make sure that we're checking potassium levels again to see if this K-Axalate enema actually worked. And lastly, if the patient is severe or their kidneys are in renal failure, we might need to resort to dialysis to help lower the potassium to a safer level. For safety measures, always make sure that when you're dealing with a patient that has a potassium imbalance, one, you're checking their kidney function to make sure that they can actually remove potassium as necessary. But two, we want to make sure that we are monitoring using continuous cardiac monitoring or ECG monitoring so that we understand what the heart is doing and can keep an eye on the heart. We should always be asking ourselves with potassium, is the heart at risk? How do I monitor this? And how do I keep my patient safe? If the patient were to have low potassium, we might give them some oral potassium, which could include some foods like oranges, bananas, potatoes, and even some avocados. So let's do a practice question. This question states that a patient has a potassium level of 2.9. Which finding is most concerning? Go ahead and pause the video, think about your answer choice, and come back when you are ready. So the answer choices for this patient states which finding is most concerning: diarrhea, muscle weakness, irregular heart rhythm, or nausea. Now, if these questions are wrote good, all of these should be concerning, but it asked you what is most concerning. So think about how to prioritize care. You could go ABCs, you could go stable, unstable, acute versus chronic. If you did ABCs here, there's no airway concern listed, nor is there a breathing concern listed, but there is a circulation concern. What answer choice might that be? If you guessed C, an irregular heart rhythm, you are correct. Now, the thing to remember is that potassium affects the heart first. Even though we do expect some muscle weakness, those cardiac changes should be the priority. Heart should go above everything else when we're talking about potassium imbalances. Our next question states, which order should the nurse question? We had one of these in our sodium video. When it asks you what should the nurse question, this would be that you've received orders from the provider, but one of them is actually wrong. One of them would be unsafe to do. And this will be for a patient that has a potassium imbalance. Is it A, potassium chloride IV infusion, B, potassium chloride IV push, C, oral potassium supplement, or D, cardiac monitoring? So you might even ask this question in a different way. You could even do it as a true false. So for A, would you give this potassium chloride infusion to the patient, right? We're going to say that has hypokalemia. You would. That would be appropriate. It's true. So that wouldn't be a wrong order to question. Would you give potassium chloride IV push? False. That would definitely be a safety issue. So we're definitely going to highlight B for right now. C, would you give the hypokalemic patient oral potassium supplements? Sure, we can definitely give oral potassium. And D, would you provide some sort of cardiac monitoring? Absolutely, because that's true. The heart needs to be monitored with any sort of potassium imbalance. So the order that would need to be questioned with this patient is B, potassium chloride IV push. This is going to be a prime safety question. You should never give potassium via an IV push. It should always be diluted in some sort of solution. It should be given slowly over an infusion pump and should be at a very particular rate, making sure not to exceed the provider's order. Question number 3. Which patient should the nurse see first? Go ahead and pause the video, look at your answer choices, and come up with your best answer. Okay, so if you look at your answer choices, usually they're going to be similar patients, but they're going to be different in their own ways. If we quickly look, we have potassium levels given for every single patient, and none of them are normal, so that's not going to help us out. We're going to have to figure out if something is hypokalemic or hyperkalemic, but our biggest factor is probably going to be looking at those patient assessments. What's the patient actually experiencing? And which one of those assessments means I need to see this patient first, they're very sick, or they could potentially die if I don't do something. Looking at patient A, we can see that they are hypokalemic with some fatigue. Well, fatigue, they're tired. That's not really that big of an important priority for me at the moment, so we'll see what the next option is. Patient B, they are experiencing hyperkalemia with some nausea. All right, they have some GI issues that might go along with the hyperkalemia. Again, not really affecting the airway, the breathing, or even circulation, so I'll just put that on the back burner. Patient C is experiencing hyperkalemia with peaked T waves. Now, what does peaked T waves mean? Those are those tall T waves. They're found on ECG readings. Oh my gosh, that's related to the heart. Heart is definitely important with the potassium, right? It's directly related to changes. I'm going to put that as my number one so far. And patient D has hypokalemia with constipation. That's a symptom of hypokalemia. Everything's starting to slow down. But again, it's a GI issue. It's not affecting the airway, breathing, or circulation. So in this case, if you answered C, that the patient with those peaked T waves was the most important priority, you are correct. They're having cardiac changes, and that's going to put the patient at risk for cardiac arrest. Remember, hyperkalemia has those lethal cardiac changes, so we've got to keep an eye on those patients because they might be those quickest ones to die on us. All right, so let's review on how we would answer potassium questions. Remember, sodium was related to the brain. In potassium's case, it's going to be directly related to the heart. So we always want to ask ourselves, is this question going to be affecting the heart? Is this answer choice affecting the heart? If it is, that should probably be my priority. Remember, with low potassium, the patient will appear weak and slow. Weakened muscles, constipation, slower reflexes. The patient with high potassium will have those lethal arrhythmias, so those tall T waves, going into cardiac arrest if we don't treat them quick enough. Make sure that you're always assessing the heart rhythm, whether that is through ECG or some sort of continuous cardiac monitoring. And our safety risk, never ever IV push potassium. It always needs to be either oral or given through an infusion pump that has been diluted. Good luck with studying potassium.